So you get a cut and you start bleeding, but after a little while the bleeding stops, and the stopping of the flow of blood is known as hemostasis. My name is Umair Ahmed, and hemostasis is what you are gonna learn in this video. When you get a cut, this causes damage to the walls of the blood vessels in that area. As a result of that, bleeding is going to escape through the damaged blood vessel, and that is what you experience as bleeding. Now, if you are just keep on bleeding for too long, that's eventually going to result in anemia. So, we have to prevent that from happening, and we want the tissue to actually heal. Now, this hemostasis involves three processes. The first is vascular spasm, the second is platelet plug formation, and the third is coagulation. Let's break these down individually. First, deal with the vascular spasm. This is also called vasoconstriction. If we look at the structure of the walls of our blood vessels, we see that the middle layer contains smooth muscles. Now, anytime you see muscles, you can know that contraction can happen. In this case, in response to the damage of the blood vessels, the smooth muscle layer will actually start contracting. This is called vascular spasm. Here is why this happens. When there is a cut, there are pain receptors. They release chemical in that local area. Also, the cells that are lining the inner walls of the blood vessels wall will release chemicals. Those chemicals will cause the smooth muscle to contract, and that action will help them to constrict the flow of blood. So that's the first step, vascular spasm, which basically slow down the flow of blood. Then there is the formation of the platelet plug. We have these platelets that are in the blood, and they are freely traveling through the blood vessels for a moment like this. Well, when there is damage to the blood vessels, it exposes the underlying connective tissues and collagen fibers that are normally in the walls of the blood vessels. And as the platelets are passing by, they are activated and change their shape. They will also release granules, and result is that they become kind of spiky and sticky. They together around the damaged tissue to form what's called a platelet plug. This entire process is helped by a glycoprotein that's found in the blood called von Willebrand factor. It helps to stabilize the platelet plug. This is kind of like a temporary internal band-aid that's helping to stop the flow of blood until we have something more permanent. And what's also cool is that as the plug forms, the platelet themselves will release other substances that helps the process even more. They release ADP, adenosine diphosphate. This helps to attract even more platelet at the site of injury. They release serotonin, which has various functions, but in this situation it stimulates and helps in this situation. It stimulates and helps to maintain the vasoconstriction as we spoke about earlier. Some other substances that are released are things like prostaglandins and phospholipids. They help to maintain the vasoconstriction as well, but they also help to activate other clotting factors, and we will talk about in a sec. The third and final process we have coagulation, also known as clotting or formation of blood clot. Now, this is a process that involves a complex cascade of events and that involves a bunch of clotting factors. The goal of this process is to form a fibrin mesh that holds the platelet plug in place so that the bleeding can happen and can take place as efficiently as possible. Here is a simplified look at how this happens. I mentioned earlier that there is a complex cascade of events. In that cascade, there are two pathways, an intrinsic pathway and an extrinsic pathway. They both involve various clotting factors. The intrinsic pathway gets activated as a result of the damage of the walls of the blood vessels, hence the name intrinsic. It's a pathway that within the blood vessels. The extrinsic pathway happens as a result of the damage of the extravascular cells, those that are not a part of the blood vessels. They are outside the blood vessels, hence the name extrinsic. Now, both of those pathways leads to a common pathway, and here is the important part. Well, it's not that important, but The key thing here, the main goal is that in the common pathway there is an inactive enzyme called prothrombin that gets converted to the active enzyme thrombin, and once this thrombin is active, it converts fibrinogen, which is soluble and inactive, into fibrin, which is insoluble and active. Those fibrin strands will form that fibrin mesh that we spoke about earlier that holds everything in place so that healing can happen. So ultimately, for hemostasis to happen, first want to slow down the flow of the blood, and the vascular spasm accomplish this. Then we want to get to the platelet plug formation, and lastly coagulation, resulting in a fibrin mesh holding everything together. And that's it for this video.